Okay, I'm Scott Cavallari and I'm with Laerdal Tech Support, Tech Service, and we're going to show how we put a skin on this IV arm. So the vein is already on here. The hardest part that everyone seems to have a problem with is getting this hand past the wrist of the skin. So I'll make sure we cover that. This arm skin is right out of the box. We haven't done anything to it. You can use a hair dryer if you want. You can blow hot air into it, which will make it a little bit softer, a little easier to work with, but I'm not going to do that. We're just going to do it the way it is, and I'm sure it'll go on with no problems. So I'm going to take this regular soap. We're going to soap up the inside of the skin first, and then we're going to do the arm last because the soap does dry pretty quick. So what I'm going to do is I'm going to take some soap. I'm going to put a moderate amount on my fingers, and then I'm going to put my hand in here, push it all the way up in here, and once my hand is in the skin, I'm going to roll the skin, put my hand up here, which will also help to stretch the wrist of the skin a little bit. When I roll it like this, this will obviously coat the inside of the skin. I'm getting my fingers all the way up into these fingers, just to get a little soap up in there. And you can see my hand is in there. So maybe just a little bit more, because the soap does dry fairly quick, and you do want to work quick. I'm keeping this hand clean without soap, which will help. Now I'm going to take some more soap and I'm going to put it on the arm itself. And it's just regular dish soap. So now we're going to lay the hand flat. We're going to take this arm, laying flat, we're going to slide it right in here. Now my hand can compress the hand of the arm. So right now the hand is in the wrist of the skin. And what you want to do is feel, because at this point the fingers are already starting to come in. So if I squeeze here, it will help that hand that's inside the skin. Fingers are already starting to go in. Squeeze here and pull. We have all four fingers are now up inside the hand of the skin. Now what I'm going to do is I'm going to leave this real quick. I'm going to rinse this hand. Okay, I just rinsed my hand off, which does help, because now we have to get it the rest of the way on. So I'm just going to wipe off any soap that's on the outside of the skin, and now we're going to work the skin up the arm. And you want to just keep grabbing it here and working the skin up. If you pull down on the fingers and keep working the palm, and then you see the skin will move up. We want these veins to be lined up with the holes in the skin, because we're going to pull the veins out through those holes. And if you glued your veins on, you don't want to glue them up any further than here. If you glue the veins all the way up to this point, they're going to have to bend back to come out of this hole. So you only want to glue up to this point. So I'm going to work it. You can feel got about 1/2 of an inch of skin right here, so the fingers, there's still more room for the skin to work up the arm. The thumb is lined up pretty good. I'm going to pull the veins. They're a little soapy. Pull the veins out through the hole. Get a hold of it. Okay, the veins are out, and the test is to be able to blow air through the vein. And I've got good air blowing through the vein. You can just, if you can't get air to blow through, you want to keep working the skin up. And just keep working it up, because if there's pressure in this area here, it may pinch the vein. So just keep working the skin and the fingers, and keep working it, and you will see the hole will slowly move up this way. But again, the hardest part is when we're bringing the hand down through here. You want to squeeze it through. You really want to be careful, because what happens is that the fingers, once they get up here, if they're not lined up, you can get two going into one, or one going into the wrong one. So you want to, this is the tricky part, is when these fingers come up right here, when you keep squeezing and pulling, is to make sure they are lined up before you get them all the way up in there. And that's it. I think we're done.